Hello guys, welcome and welcome to Meet International Academy, one of the leading academy in training nurses and nursing competitive exam as well as IELTS, NCLEX and OET training. Welcome back to Magic Pill session. See, already you know that in Magic Pill session we are discussing the MCQs, 5 important MCQs along with the rational. Not only rational, we are also discussing the additional golden points in MCQ series. So already 100 videos it is there streaming in YouTube channel. This is the 101st video. So watch the video till the end. We are discussing important topics. These topics from these topics and these MCQs you can get the questions in the upcoming competitive examination like NORCET-8. So watch the video till the end. Definitely it will be so much useful for you. So let's begin the session with a motivational thought. Don't watch the clock. Do what it does. Keep going. So this is the thought. See, clock never stops. Same like that in our life, we have to determine a goal and we have to chase the goal. Okay, so with this thought, let's begin the session. The topic what we are going to discuss today is from oncology. In oncology, important MCQs and the golden points related to that particular MCQ we are going to discuss. If you have any doubt, please drop your message in the comment section. So the first question what we are going to discuss is, which of the following cancer is not associated with beta HCG? So this is the question, not associated with the beta HCG. Okay, so understand the concept. 4 options they have given here: choriocarcinoma, gestational trophoblastic tumor, prostate carcinoma, identiform mole. 4 options they have given here. Among this, which is not at all related to beta HCG? This is the question. Okay, so for understanding, for solving this type of question, first you should know the rationale of each and every options. Okay, see, the best main thing is choriocarcinoma, gestational trophoblastic tumor, identiform mole. Option A, B, and D. All these 3 options are related to beta HCG because the 3 are related to trophoblastic cells. In the next slide, we will be discussing what is trophoblastic cells. Okay, fine. So for this, the right answer is going to be what? Option C, prostate carcinoma. Prostate carcinoma is not at all related to beta HCG, whereas choriocarcinoma, gestational trophoblastic tumor, identiform mole are related to beta HCG. How? That we are going to see in the rational in the next slide. Before discussing about the rational, I would like to say few more tumor markers, which is very important for your upcoming examination. In the exams, they will be asking for prostate cancer, what is the tumor marker? For choriocarcinoma, what is the tumor marker? Like that, different direct questions, there is a chance for ask in the examination, especially in the NORCET-8. So you have to be very careful. You should know all the tumor markers. So watch this slide. The first tumor marker is PSA, prostate specific antigen. Okay, it is used to identify the prostate cancer. The next one is CA125. It is used for identifying the ovarian cancer. Okay, all these things are memory based, guys. So make a note of it. Okay, PSA for prostate cancer, CA125 for ovarian cancer, CA2729 and CA153. It is for breast cancer. And CA99 for pancreatic cancer. See, in the exam, you can get the questions like this also, which is the very worst prognosis cancer. If they're asking the question like this, worst prognosis cancer, then you have to answer what? Pancreatic cancer. Okay, all these tumor markers, whatever I'm mentioning here, is very important. Okay, so the next tumor marker is thyroid transcriptase factor 1. In short, also they can ask in the exam, that is TTF1. It is used for what? Used for identifying the lung cancer. Thyroid transcriptase factor 1 is used to identifying the lung cancer. The next one is calcitonin and CEA. Okay, carcinoma embryonic antigen. Okay, CEA means carcinoma embryonic antigen. So, and calcitonin, in these 2 things are used to identify the thyroid cancer. The next one is VMA, vinyl mandelic acid test. It is used to identify pheochromocytoma. You all know that what is the meaning of pheochromocytoma? Pheochromocytoma means tumor in the adrenal gland. Okay, so for identifying the pheochromocytoma, vinyl mandelic acid test is the confirmatory test for identifying the cancer. The next one is carcinoma embryonic antigen. So it is commonly seen in these 3 diseases, that is in pancreatic cancer, colonic cancer, and also in the breast cancer. Okay, the next one is alpha fetoprotein. Repeatedly asked question, guys. In this question, alpha fetoprotein. Okay, so alpha fetoprotein is commonly seen in the liver cancer. Okay, and the last, very important, recently this question asked in the exam, that is bladder cancer. What is the tumor marker? So the tumor marker for bladder cancer is HMWCK. What is the full form of HMWCK? High molecular weight cytokeratin. High molecular weight cytokeratin. See, all these tumor marker, please memorize it. These are all memory based things. Take a separate paper, write the tumor markers. Okay, definitely you can get the question from here. Tumor markers are very, very, very important. Okay, so now you means everyone understand what is the tumor marker for each and every different type of cancer. Now let's move again to the same question. The rationale of this question, that is, which of the following cancer is not associated with the beta HCG? Okay, and we got the answer, that is prostate carcinoma, but we should know the rationale about these things. For understanding the rationale, this slide is very, very important. In this slide, understanding about the trophoblastic cell is very important. See, what is trophoblastic cell? See, trophoblastic cells are a cell, specialized cell, which is covering the embryo, The main function of the trophoblastic cell is the embryo will be attached with the endometrium, uterus endometrium layer. So who is helping for the attachment of the embryo in the uterus is trophoblastic cells. The one which is helping, see, the first point is the trophoblastic cell is the one which is covering the embryo. Second point is it is the one which is used to attach the embryo in the uterus. And also it is secreting what? Beta HCG. So this is the basic concept you should know for solving this question. So now everyone understand what is trophoblastic cell, right? So now let's go into the disease. So trophoblastic cell is the normal specialized cell, whereas the disease which is present in the trophoblastic cell is called as what? Gestational trophoblastic disease. Gestational trophoblastic disease, it is classified into two. That is, the first one is choriocarcinoma and second one is hydatidiform mole. Choriocarcinoma is the highly malignant gestational trophoblastic neoplasm, guys. Okay, choriocarcinoma is what? It is one neoplasm. Okay, it is a cancer cells. Okay, fine. So choriocarcinoma is the cancer cell which is formed in the trophoblastic cell. That's all, finish. So you all know that in trophoblastic cell, what is produced? HCG is produced. So in case the cancer cell which is present in the trophoblastic cells is also producing HCG, means just think how much amount of HCG will be produced in the gestational trophoblastic disease, that is in choriocarcinoma. So excess amount of beta HCG will be produced in the choriocarcinoma. So it is related to the question. Okay, the next one is hydatidiform mole. See, hydatidiform mole is an abnormal pregnancy where the placental tissues grows excessively. Okay, choriocarcinoma, the placental tissues, it will grow excessively. Okay, due to improper fertilization. Actually, there are two types of hydatidiform mole, that is complete mole and partial mole. Complete mole means there will not be any fetal tissues, only the placental cells will be present. Okay, partial mole means some fetal tissues will be present. You should know the difference between the complete mole and partial mole. In the exam, you can get the questions like this also. Okay, so on the whole, hydatidiform mole is also from the trophoblastic cell. Choriocarcinoma, it is also from the trophoblastic cell, and gestational trophoblastic disease is nothing but choriocarcinoma and hydatidiform mole. Okay, so on the whole, everything is secreting what? Beta HCG. That's why these things are related to the question. And prostate cancer, it is not at all related to the question. That's why we selected option C. Hope now you understand the concept, right? Let's go to the next one. This is very simple, but still additional points are very important in this question. The pap smear is used for which of the following? So this is the question. The pap smear is used for which of the following? Okay. See, this is a repeated one-liner question. So already many times this question asked in the exam, and it is very simple question also. 4 options they are given here for pap smear: lung cancer, colon cancer, cervical cancer, pancreatic cancer. 4 options are there. So pap smear is used for which of the following? To identify the cervical cancer. So this is very simple, but the additional point what we are going to discuss is very important. Okay, so let's see the additional points. See, the first point is the pap smear is also called as what? In the exam, either they can ask as a pap smear, otherwise they can ask as a Papinicolos smear. You can see here, Papinicolos smear. Okay, either Papinicolos smear or pap smear, both are same. Okay, so in the exam, if they are asking in different name, don't get afraid. So Papinicolos smear or pap smear, it is actually a screening test. Here, what they are doing, you can see in this image, they are collecting the cells from the cervix by using a spatula. Okay, they are collecting the cells from the cervix by using the spatula. And here the name of the spatula is again very important. You can see this is the spatula, image-based question. If you are getting like this, means it is nothing but the spatula used for pap smear. The name of the spatula is Array spatula. A-Y-R-E. Array spatula. Okay, the shape will be like this. Okay, so this is the second point. And third point, so what is pap smear? You know that it is collecting the cervical cells. Okay, in order to identify the cervical cancer. So in pap smear, actually it is a screening test. It is coming under what? Secondary level of prevention. You all know that 4 types of prevention is the primordial, primary, secondary, tertiary, like that. Different levels of prevention is there. And pap smear, not only pap smear, breast self-examination, testicular examination, everything is coming under what? Secondary level of prevention. Okay, so all these important points are related to this question. Okay, so the next question what we are going to discuss is which among the following is not present in the tumor lysis syndrome? Very important, repeatedly asked question. So here it is a not question, not present in the tumor lysis syndrome. Understand the concept. Okay, so for solving this question, you should know what is tumor lysis syndrome. See, any cancer tumor, if it is broken down, so many particles like potassium, phosphate, uric acid, everything will come out from the cell and it will enter inside the blood vessel and it will cause so many changes in the body. Okay, so that is called as what? Tumor lysis syndrome. Just consider that a group of cancer cells suddenly broken and sodium, not sodium, potassium, phosphorus, uric acid, everything is coming into the blood. So what will happen? Hyperkalemia will be there, hyperphosphatemia will be there, hyperuricemia will be there, right? So these kind of changes suddenly happen in the body means it will affect the body, even if the patient will go for what? Cardiac arrest. Okay, so all these things should come into your mind if you hear the word tumor lysis syndrome. So here in this question, the question is not present in the tumor lysis syndrome. Let's see the options. Hyperkalemia, hyperphosphatemia, hyperuricemia, and hypercalcemia. 4 options are there. Okay, as I mentioned already, consider this is a cancer cell. What is this? This is a cancer cell. So if the cell is broken, damaged, okay, what is released? Potassium is released. Second, phosphate is released. And third, if the DNA, nucleic acid, the DNA, RNA is broken down means uric acid is released. Where it is released? Everything is released inside the blood vessel. This is the blood vessel. Everything is released inside the blood vessel. If the potassium is excessively released into the blood vessel, what will happen? Hyperkalemia will be there. If phosphate is excessively released in the blood vessel, hyperphosphatemia will be there. If uric acid is excessively released, means hyperuricemia will be there. So what is left? Hypercalcemia will not be there. Why? Whenever there is a hyperphosphatemia, phosphate is just opposite to calcium. So phosphate level is increased means automatically the calcium level will go down. So here what should be there? Hypocalcemia should be there. That is the right one. Okay, hyperkalemia, hyperphosphatemia, hyperuricemia, hypocalcemia. So these are all the 4 correct things should be there in tumor lysis syndrome. Whereas here they have mentioned hyperkalemia. So this is the wrong answer. And here the answer what we have selected is, because it is a not question, so here the right answer is going to be option D, that is hypercalcemia will not be there in the tumor lysis syndrome. You understand the concept? Which is not there in the tumor lysis syndrome? Hypercalcemia will not be there in the tumor lysis syndrome. And additional golden points you can see here. I have given the clear explanation for tumor lysis syndrome already. I think no need to repeat again and again. And the key features, this is very, very important for your exams. That is, in tumor lysis syndrome, hyperkalemia, hyperphosphatemia, hypocalcemia, hyperuricemia, these 4 things will be there. Please make a note of it. Okay. And apart from that, whenever I'm discussing about hyperkalemia, it will cause death. See, hypocalcemia, hyperphosphatemia, hyperuricemia will not cause any death, but hyperkalemia can cause cardiac arrest and death will be there. So how to manage the hyperkalemia? This is also very, very important question. Scenario based question, if you are expecting, means this kind of critical care scenario question you can expect in the examination. There are so many management to treat the potassium level. You can see one by one. The first and foremost management is, in case of tumor lysis syndrome, first we need to protect the heart. How we can protect the heart? First management is we have to administer what? Calcium gluconate. We have to administer calcium gluconate in the ratio of 10:10:10. See, the calcium gluconate, it is available in 10 ml and it is coming in 10%. When we are administering, always we have to dilute and administer. While we are administering, we have to administer slowly up to 10 minutes. Okay, while we are administering, we have to connect the patient to the cardiac monitor and then we have to administer the medicines. Okay, so 10:10:10, 10 ml, 10%, and at least 10 minutes duration we have to administer the medication. So calcium gluconate, why we are administering? To protect the heart, because the heart can go for what? Cardiac arrhythmias because of hyperkalemia. Okay, first point is over. The second point is, while you are giving, if there is an increased potassium level, the second management is we have to administer insulin plus dextrose. Mostly in the hospital settings, 10% of regular insulin. Understand the concept? 10% of regular insulin, which is added in 25% of dextrose. Once again, I will repeat, 10% of regular insulin in 25% of dextrose, they will be mixed and they will be giving to the patient. Okay, fine. So why we are giving like this? The insulin will shift the potassium from the blood vessel into the cells. So in the blood vessels, automatically the potassium level will go down. So this is the emergency management. Okay, so shifting the potassium from the blood vessel into the cell by using the insulin plus dextrose solution. The third management is beta agonist. That is nothing but salbutamol nebulization. So we can give the salbutamol nebulization, but this is not that much effective like insulin. Insulin and dextrose is more effective when compared to salbutamol, but first line of in normal ward setup, if the potassium level is little high, we can go with the salbutamol. But in critical care areas like this, severe hyperkalemia, we should not take risk. We should not give salbutamol nebulization. Instead, we have to go with what? Insulin. The next one is sodium bicarbonate administration. Okay, so sodium bicarb is also shifting the potassium from the blood vessel into the cells. Okay, and all other managements like, loop diuretic, sodium polystyrene sulfonate, dialysis, these things are the lost management. So on the whole, calcium gluconate is the first one to protect the heart. Second one is insulin plus dextrose. Third one is salbutamol nebulization. Fourth one is sodium bicarb, that is sodium bicarb. And the fifth one is like loop diuretic, sodium polystyrene sulfonate and dialysis. So these are all the management in order to treat the hyperkalemia. So these things also you're supposed to remember. The next question what we are going to discuss is an external source of ionizing radiation is pointed at a particular part. From the outside, it is pointed out in the particular part of the body is known as. So here you have to search for the key point, the ionizing radiation. So for a cancer patient, we will be giving what? Radiation therapy. So ionizing radiation we are giving to the patient pointed at a particular part. Matlab, you are pointing at a particular part. From outside, you are pointing at a particular part. Okay. So it is known as what? So this is the question. Teletherapy, brachytherapy, chemotherapy, and microwave therapy. 4 options they are given here. Here, the main thing you supposed to understand is external radiation therapy, internal radiation therapy. Internal radiation therapy is nothing but brachytherapy. But here in this question, they doesn't mention anything about internal. They just mentioned pointed at the particular part. It understood that it is a external radiation therapy. It is self-understood that it is a external radiation therapy. External radiation therapy means immediately you have to think about what? Teletherapy. So here the answer is going to be what? Option A, that is teletherapy. Okay. So additional golden point which is related to this question is first you should understand teletherapy and brachytherapy. As I mentioned already, you can see here, this is the teletherapy. Okay, this is the teletherapy. External source. Through an external source, the radiation is going and hitting the cancer cell. That is called as what? Teletherapy. In teletherapy, 2 things are very, very important. The first one is the name of the machine and the second one is this mask. What is the name of this mask? Okay, the name of the machine you can see here very clearly. The name of the machine, there are 2 names for this machine. The first one is linear accelerator machine. This is the name of the machine, linear accelerator. This is the machine. It is also called as Betatron machine. In the exam, either you can get the options like, linear accelerator machine or Betatron machine. So both are correct only, linear accelerator or Betatron. Okay, so both are external radiation machines, which is used in the teletherapy. And also one more thing I have said. So here you can see a mask, a plastic mask, right? It is called as thermoplastic mesh mask. Thermoplastic mesh mask. What is the purpose of the thermoplastic mesh mask? It is used to immobilize the cancerous area. For example, this person is suffering from the brain tumor. Okay. So while doing the teletherapy, if the patient is moving like this and this means they cannot point out exactly the tumor cells, right? The immobility will be there. So if they are moving here and there means definitely the radiation therapy will damage the normal cells also. So in order to immobilize the patient head, neck and trunk, they are using this type of thermoplastic mesh mask so that the movement is avoided and directly the radiation will target the cancer cells and destroy the cancer cells. That's why we are using this thermoplastic mesh mask. These kind of things can come in the image-based question. Please make a note of it. So this is all about the teletherapy. The next important thing is brachytherapy. See, brachytherapy, 2 things are there. The first one is unsealed and second one is sealed. Okay, in unsealed, it is the ionizing agent which we are using in a liquid form, that is called as what? Unsealed brachytherapy. Unsealed brachytherapy means here we are going to use the cesium sticks. What sticks? Cesium sticks. You can see here, this is a type of cesium sticks which is used to provide the radiation on the cancer cells. You can see here, this person is inserting the cesium stick, okay, on the consider this is the prostate. Yes, this is the prostate cancer. So cesium stick is inserted. After inserting, it is going to emit the radiation. Okay, so this is one type. One more thing is there, that is needle releasing the seeds. Means iron rod, they will be inserting a small iron probe like instrument, they will be inserting like this. Okay, from this small iron metal, small radiation producing seeds are implanted in the prostate gland. You can see small radiation producing seeds which is implanted on the where? Prostate gland, because prostate cancer is present, so they are implanting these small seeds which is coming from the metal. Okay, and this one will emit the radiation continuously. Okay, so these things are coming under what? Sealed brachytherapy. So on the whole, two types of brachytherapy, unsealed and sealed. In unsealed, liquid ionizing agent are used. In sealed, they are using this kind of seeds and also cesium sticks. Understand the concept? Yes. And one more important thing is radiation therapy. What all the nursing care we have to keep in mind? Not only nursing care, our nursing precaution we have to take. Okay, so those points here I have mentioned. First, let's discuss about the radiation therapy. In radiation therapy, the anti-emetic has to be administered before the treatment. That is very important, because whatever the chemotherapy drugs you are giving, the first and foremost side effect is vomiting. So we have to go with what? Anti-emetic drugs. Okay, fine. The next one is provide good skin care, wash with the water and avoid lotion and sunlight. If you are giving the skin care, you can wash only with the water. Okay, and if the radiation is pointing toward the abdomen, even you can expect the diarrhea and constipation. And the very common problem what the radiation therapy patient is expecting is dry mouth. So we have to give what? Plenty of fluids. The next one is internal radiation therapy, also called as brachytherapy. Here we are using the cesium sticks. Already I have mentioned. Here you can see the cesium sticks which is inserted here in the prostate gland. Okay, so once these cesium sticks are inserted, the patient should be in the bed rest during the entire treatment. Okay, even they should not move here and there for voiding the urine. So Foley's catheter has to be inserted. Okay, if radiation, the cesium sticks are fallen down, you have to use the forceps and take the cesium sticks through the forceps and drop in the lead container. Okay, and if the nurse is pregnant, they should not enter inside the room. And frequent rotation of the nursing care person is very important. Okay, so these things are very important while you are handling the question which is related to brachytherapy and teletherapy. Okay, the next question is the most serious long-term side effect of bleomycin therapy is. So here they are asking the side effect of the bleomycin. Bleomycin is also a chemotherapy drugs. Okay, so here they are asking the side effect. Let's see the options. Pulmonary fibrosis, cataract formation, cardiomyopathy, aplastic anemia. 4 options they have given here. It is a direct question. So side effect of bleomycin therapy is option A, that is pulmonary fibrosis. See, not only bleomycin side effect, we are going to discuss other chemotherapy drug side effect also, because these questions are already asked in the exams. So what are all they? You can see here. The first one is cisplatin. If you are administering cisplatin, ototoxicity and nephrotoxicity might be there. The next one is cyclophosphamide, hemorrhagic cystitis. This question already asked in the exam, and cardiotoxicity will be there. And 6MP, hepatotoxicity, bleomycin or busulfan. Bleomycin is related to this question only. So pulmonary fibrosis will be there. Doxorubicin, cardiotoxicity, vincristine, peripheral neuropathy and constipation, vinblastine, myelosuppression. In all the chemotherapy drugs, myelosuppression will be there. Etoposide, gastrointestinal toxicity, hypotension, tamoxifen, hypercalcemia, methotrexate, hepatotoxicity, and photosensitivity. All these things are again a memory based things. Take a separate paper and write each and everything. Okay, fine guys. So most of the questions we have discussed related to the oncology. This is part 1 video, and in part 2 video also we are going to discuss with the important MCQ which is related to oncology only. So if you have any doubts anywhere, you can drop your message in the comment section, and if you like the video, please like it, share it, and subscribe to our channel. And all the best for your upcoming examination. Thank you very much guys.